So our project is on the nursing shortage and how, as nurse leaders, can we affect the nursing shortage and possibly find a solution. So a nursing shortage is when there is a global and it is a global and national issue that can directly affect patient care and healthcare in general. So the definition of a nursing shortage is basically when there's more patients but less nurses. So this could be due to more nurses dropping out of the field, less people wanting to go to school to become a nurse. So this issue must be addressed because there are more patients who are living longer. We're seeing since like the 1900s, we're seeing that the expected age, it has gotten higher up than it has been, so more people are living past their expected age. So this means their patients are having more comorbidities that come with aging, like diabetes, chronic illnesses, hypertension, hyperlipidemia, dementia. So that leads to more patients being in the hospital, since they're in the hospital, but there's less nurses. So this could lead to a reduction in the quality of care and even death due to inadequate care. So this could be like medication errors, patient errors, where a nurse has too many patients and she gets them all mixed up and she doesn't have good time management, and these patients aren't getting enough time with the nurse that they need to improve in their health care. So we wanted to find out through the public why what their opinions on nursing field, and why did they or did they not choose to become a nurse. So we formulated and conducted a survey, and we found some common findings that deterred people from becoming a nurse are due to lack of pay, unsafe working conditions. That ties back into a nurse having multiple patients. That is a good nurse to patient ratio. So like saying 1 to 8 patients is not safe. Then we have lack of appreciation for patients, hospitals, and etc. So there's going to be more patients taking nurses for granted. We see a lot of that in the news outlet and on social media. Nurses talking about how their patients are rude, they're getting assaulted by patients, and the hospitals are kind of just brushing it off because they're more focused on satisfaction of the patient and satisfaction of their employees. Then we have an increase in nursing burnout. This ties into where if the more of the population is living longer, so that means there's more patients in the hospital, which causes burnout in a lot of nurses. Social media portrayal of nurses. This can be, we have seen in the news, nurses being arrested or losing their license due to medication errors, and then nurses getting assaulted by a patient. I feel like we've seen and heard about those two situations a lot recently. Okay, so a little background to the nursing shortage. I kind of hit on these points on the first slide on why is there a nursing shortage. It's due to the reasons like I stated in the first slide. The aging population, higher patient acuity, and the expected life expectancy increasing. But this also ties in with other internal challenges, such as high turnover rate. So this is when nurses start a job and they only stay a couple of months and then they leave. So we have a high turnover rate, which leads to less nurses on that floor working. And then another challenge is a shortage of new graduate nurses. So that's what we kind of wanted to find out, is why is there less people in the public wanting to pursue nursing and going to nursing school. So we did that by conducting the survey, like I said in the previous slide. So this crisis was identified throughout history, there have been multiple incidents of a nursing shortage, but the one we are in right now has been going on for a couple of years. We really saw the number of nurses decline after the COVID-19 pandemic. And this is because COVID-19 pandemic was so quick, and there was a lot of nurses working multiple days, risking their life, seeing a bunch of death every day, and seeing a bunch of stress that after the COVID-19 pandemic, multiple nurses left bedside nursing to pursue other careers, such as being a nurse in the doctor's office or in like DHEC or public health. So we really saw the levels of nurses plateau in recent years. Like in my PowerPoint, I have a study done in 2021 by Spring Arbor University. They saw the number of registered nurses drop by more than 100,000 between the years 2020 to 2021. So that is during / before the end of the COVID pandemic. And what is the current practice? So we have seen multiple hospitals and organizations offer incentives. Like the most popular one I believe I have in my PowerPoint is sign-on bonuses. So this is when a hospital or an employer offers a sign-on bonuses to persuade more nurses to work on that floor or work with their hospital. So this is one intervention or way we can try to alleviate the nursing shortage. However, the cons of sign-on bonuses is we have that they're taxed, and this means nurses usually have to work on that floor for at least 2 years to receive the full amount. So because of these, most nurses don't want to take a sign-on bonuses because they don't want to be tied to a floor for a certain amount of time.
For the assessment portion, we're going to be talking about the variables that contribute to the situation, which include word of mouth and social media showing the negative aspects of nursing, such as nurses being arrested. Nurse-sensitive indicators, the NSIs, are specific measures that reflect the quality and impact of nursing care on patient outcomes. The NSIs focus on areas where nursing has a direct influence, such as patient safety, quality of care, and patient satisfaction. Our project addresses the 3 aspects of the NSIs, which are the structural indicators, the process indicators, and the outcome indicators. The structural indicators include the environment and resources that support nursing care. Insufficient nurse staffing ratios affect care delivery. The public's view of nursing being undervalued and misunderstood is reflected by the nursing shortage. Process indicators, this is the actions and interventions nurses perform when providing care. The nursing shortages often lead to overworked staff who have less time for evidence-based practices, such as patient teaching or hourly rounding. By improving the public's perception, we could support better collaboration, respect, and communication between care team members. Outcome indicators, this is the results of nursing care on patients or systems. The nursing shortages negatively affect outcomes such as increased errors and decreased patient satisfaction. Improving the perception of nursing can lead to better recruitment, retention, and staff morale, thus improving both nursing and patient outcomes. Over time, this will reflect through lower adverse event rates, higher patient satisfaction, and improved nurse well-being. The risk to patients includes, the risk to patients is related to the decreased number of individuals seeking to enter the nursing field due to the negative societal perception of nursing. This directly affects patients and places them at risk. The negative view surrounding nursing is caused is causing individuals to avoid the profession, leading to a domino effect of nursing shortages, unsafe nurse-patient ratios, improper nursing documentation, and unsafe nursing practice, all of which will negatively impact patients. These effects can cause harm to patients in a multitude of ways, such as accidental medication errors, unintentional patient neglect, and unfortunately, possibly death. Some resources to implement a practice change includes commercials, flyers, or even speakers for high school students that overall aim to educate the public regarding the positive aspects of nursing, which include like the positive impact made on communities and families and in the patients, a sense of fulfillment for nurses, and job stability.
So, based on what we gather from the survey, a lot of nurses feel that the profession could really benefit from a stronger support systems. Things like better incentives, better training, and more structure within the workplace. A big theme that came up was retention. Many nurses said that issues with staffing and management are driving people away, so focusing on safe staffing and supportive leadership can make a major difference in job satisfaction and patient care. Another idea was to change how we talk about nursing publicly, showing more positive stories and experience both in the media and on social platforms could really help shift the public's perception. Some people also suggested outreach, like visiting high schools, hosting hospital tours, and participating in career fairs. This is a great way to inspire the next generation and show how diverse and meaningful the nursing field really is. To actually make these changes happen, we'll make a few steps. One would be to create realistic commercials or social media campaigns that show what nursing actually looks like, the teamwork, the impact, and the variety of roles. We can also partner with schools and colleges to host more career fairs or job shadowing opportunities so students get first-hand experience. And overall, we want to use different platforms to highlight the diversity in nursing, showing that it's just not bedside care, but leadership, education, community health, and so much more. The study I put in is from 2016 by Gervin, Jackson, and Hutchinson. They found that the public often gets a skewed image of nursing. Media portrays tend to focus on negative or outdated stereotypes. This shows that there's a real need to reshape how nursing is represented if we want to improve recruitment, retention, and respect for the profession.
For our survey data collection, we shared a Google survey on Facebook and all of our social medias that lasted from October 28th to November 3rd. We got 135 responses, and 72 were from healthcare workers. Their feedback guided the message of our commercial. We focused on our script on the positive impact of nursing and picked simple filming locations for our pre-production. For our production, we filmed short clips of our group showing teamwork, compassion, and purpose. For the post-production, we edited everything into a 30 to 60 second video with captions, music, and inclusive visuals. For the distribution, we plan to post it on TikTok, Instagram, and Facebook to reach a wide audience. And to evaluate, we will track the views, likes, comments, and feedback to see the impact that our commercial made.
So let's talk about outcomes for this project. Our outcomes are to get more students interested in nursing, to increase enrollment in nursing programs, and to create a more positive idea about nursing from the social media aspect. Also, another outcome would be to offer more shadowing opportunities for people to gain more insight about what nursing actually is, and also to keep healthcare facilities fully staffed. Overall, our main expected outcome is to ultimately end the nursing shortage. The good news is that these outcomes are attainable. With interventions that we will implement, such as the positive nursing commercial, career fairs for high school students, and more chances for people to shadow nurses, we can really make a real impact on the nursing shortage over time. And is a timeline applicable? Yes, a timeline will be applicable here. It keeps us on track for events that will need to be planned, such as career fairs and a date for our commercial to be released. A timeline could also be a useful tool for us to see how our efforts are paying off and which interventions we can check off of our list.
Ethical considerations that we included to ensure the validity of our project includes prioritizing anonymity of participants taking our survey and minimizing the bias towards participants. For example, all group members posted the survey link to their social media accounts on public forums where anyone can see it and participate. This helps to limit personal bias, for example, asking someone directly to participate in the survey. This would compromise the anonymity of participants and decrease the amount of bias while increasing diversity of responses. This helps produce the most honest responses and give us a bigger picture of the overall opinions and results of our survey. We also utilize transparency in disclosing who's conducting the survey, what we are asking participants to do, and how the data collection would be used. With our survey, we tried to respect participants' privacy by keeping the identifiable factors anonymous, such as name, date of birth, where they live, or what they look like. Lastly, another ethical consideration we implemented in our survey was using inclusive language. We based our questions on our survey on a 5th grade reading level. This helps ensure that all participants would understand what the survey is asking to make completion of the survey both easier for the participants and yield more honest and reliable results.
Okay, the Institutional Review Board, or IRB. The IRB reviews studies that involve human subjects to make sure that the subjects are protected. Our project does not pose any risk to these human subjects. We're just looking at the public's perceptions surrounding nursing and how the media may influence that. Since the risks to the human subjects are absent or very minimal, an IRB review is not needed. Also, an anonymous or voluntary survey was completed, and this also fits into the exemption criteria for the IRB. For the Quality Improvement Project, or QIP, a QIP focuses on improving patient care or the clinical processes. We meet this criteria for the QIP since we are addressing the nursing shortage, and by decreasing the nursing shortage, this will improve patient care by providing safer nurse-patient ratios. This would also improve the clinical process by lessening the risk of mistakes that may come with a big patient assignment.